Lancet publication reports that an expert in rural health advises governments to take a systematic approach to tackling the coronavirus crisis rather than focusing solely on urban areas. Now, the health publication further states that one of the most striking images of the coronavirus disease pandemic is its spread from major concentration areas, such as cities, to less densely populated communities, such as rural areas. Now, resources tend to be focused more on cities, while overlooking communities in rural areas. So how important is it to empower communities on the fringes of cities and those in rural areas? Well, to discuss this further, we're joined by Dr. Phillip Gama, a medical doctor in Richards Bay who works closely with communities in rural areas. Dr. Gama, thank you very much indeed for your time.
Thank you. Thank you for having me.
So what is the data showing you? What is the research showing you on the ground with regards to knowledge that people have, especially in rural areas, about COVID-19?
Well, with my interaction with patients in rural areas, the information is getting there, but unfortunately not all the correct information is getting. People are aware of the disease, but they also have some misconceptions about the disease, especially with the symptoms and signs and exactly how to seek help when they do have those symptoms and signs.
So it's important to air these misconceptions so people hear it and know that it is false. What are some of these misconceptions?
Well, for example, people in rural areas where I work still have a misconception that this is a disease of the rich, of white people, people who've been overseas. They feel that they will not get exposed to this. They haven't seen anyone in their community who's been diagnosed. So there is that misconception, unfortunately. And they also don't understand the full signs and symptoms. For example, I get patients coming to my practice with headaches, with stomach ailments, who ask me, is this the disease? Is this what's killing people? So that information hasn't really gotten to those areas well enough.
So what needs to be done? I mean, do we need to ramp up this education program and concentrate in rural areas? Do you think enough is being done, or are people hearing the information but disregarding it?
I think they are hearing the information, but we also need to remember that there is this new entity called fake news. So unfortunately, people are getting stories, they're hearing what's happening, but the source of the information isn't always reliable. So people are mainly hearsay information that they get, unfortunately. And also, one of the main issues right now that I do see in rural communities, as much as they understand that this is a killer, they are also suffering much more with regards to the financial aspect of the lockdown at the moment.
Look, fear and anxiety around this disease can lead to stigma. Stigma and discrimination often occurs when people associate a disease with a particular population or nationality, which is wrong. How are you personally trying to, counter the stigma with regards to COVID-19 in your daily work?
Well, we do try to educate our people as much as we can. For example, yesterday we had a chance to interact with a largely rural community. We went out to hand out some food parcels. And we discussed, to talk to them, ask them what do they know about the disease, what's their understanding of it. And obviously we try to impart as much knowledge as we have. Also to try to allay the fears that people might have with regards to this disease. We make them understand that there are ways that you can protect yourself, there are ways that you can limit the chances of getting the disease. So I think that's important. We need to do a lot more of that. We actually need to go to these areas and educate our people.
What are some of the lessons, Doctor, that we can learn maybe from other countries? Reportedly, there was a trend in Italy where young people were going to the more rural areas, and we know that Italy has a huge elderly population and thereby infecting people in those areas. Could we see the same here in South Africa? Are you afraid that could happen in South Africa, where young people leave the cities and go back to rural areas and start, this disease increases exponentially in that regard?
Yes, definitely. That is a very high risk. In our rural areas, obviously, we have the go-go's who are staying there, who are looking after the children. And as we have seen with the numbers, it's largely the elder patients who are at risk.
Yeah.
So we do discourage that we do discourage this movement of people from urban areas to rural areas. Obviously, right now, what we have seen is the disease is highly focused in urban areas. So if they do move towards the rural areas, there is a higher chance that the infection rate might increase, and it will infect people who are already at high risk.
Yeah.
So yes, we do discourage that. I think we need to educate our people much more about that. Obviously, with the lockdown, people do see this as some sort of a holiday, and they want to go back home. Strongly suggest that they don't, to protect the elderly in those communities.
And Doctor, another misconception out there is that young people are shielded from COVID-19, which is not the case. The WHO was saying that, a couple of weeks ago, they were getting numbers in that a lot of people, a huge proportion of people under the age of 50 were being hospitalized due to COVID-19. So are young people, from your experience on the ground, taking this seriously enough?
They are to a certain extent, but not as much as I would like them to, let me say. And I think the other issue that we need to be really, really vigilant about is our levels of HIV, diabetes, hypertension, those chronic conditions that are very prevalent in our communities. And this puts our people at a higher risk, especially the young people where the HIV infections are very high at the moment.
Yeah.
So we need to focus on that as well, educate them that it's not a disease of the elderly, it's not a disease of the infirm only. Anyone can get this disease, and it can become severe in anyone. So we all need to be vigilant about it.
How are you doing, Doctor? I often refer to as our medical practitioners on the front line, taking care of the vulnerable as the angels among us. I mean, you guys are risking your lives, basically, to protect us. How are you coping in this pandemic?
Well, I think it's taking a strain on everyone. We are doing our best to protect ourselves. We are using the necessary equipment, the masks, the gloves, washing our hands. It has put a strain on us, but we are coping, and we are very, very thankful. We'd also like to encourage people to stay at home. As much as we are doing our best, we don't want to be put in a position where we need to be doing our best. You know what I mean?
Yeah.
We would rather people stay at home and people don't get this infection.
Yeah.
Rather than prevention should be better than cure always.
Yeah, you go to work so people can stay at home, isn't it? Doctor, thank you very much indeed.
Definitely.
Appreciate your time, appreciate all the work that you are doing in that community there. And we'll probably get you back on the program and get to more of your experiences on the ground. We need it. We need real stories on the ground. Thank you very much indeed for your time.
Okay. Thank you for having me.
All right. That was Dr. Phillip Gama, a medical doctor in Richards Bay. Well, we do